Title: Understanding Hair Loss in Young Men. Causes, Solutions, and When to Seek Help. Hair loss is a common concern, especially for young men who notice a few strands falling out when they run their fingers through their hair. If you've ever found yourself worried about losing 5 or 6 hair strands at once, you're not alone. It's a scenario that many of my young male patients bring up during consultations. However, the question often arises, is this really a cause for concern? Normal hair shedding versus hair loss. First, it's essential to understand the difference between normal hair shedding and hair loss. Losing 50 to 100 hair strands a day is perfectly normal and is part of the natural hair growth cycle. Our hair follicles go through phases, and shedding is simply a sign that older hairs are being replaced by new ones. If you're losing a few strands each day, that's nothing to worry about. However, if you begin to notice significant thinning of the hair, widening of your hairline, or bald patches, that's when it becomes concerning. Thinning hair, especially in young men, can often signal male pattern baldness, which is genetic and related to hormonal changes. Stress and its impact on hair health. One often overlooked factor in hair loss is stress. Chronic stress can lead to a condition known as telogen effluvium, where a large number of hair follicles prematurely enter the shedding phase. This is reversible in most cases once the stressor is managed, but it's an important connection to recognize. If you're dealing with significant stress, whether from work, studies, or personal life, it could directly impact your hair health. Incorporating stress reduction techniques, such as mindfulness, exercise, or deep breathing exercises, can not only help your overall mental health, but also promote healthier hair growth. For instance, one study published in the Journal of Clinical and Aesthetic Dermatology found that reducing stress improved hair density in individuals experiencing hair loss due to stress-induced shedding. Peptide serums, an effective solution. When it comes to taking proactive steps to address hair loss, one of the most effective solutions is the use of peptide serums. Peptides are short chains of amino acids that play a vital role in various biological functions, including promoting hair growth. Certain peptides, such as copper peptides, are known for their ability to stimulate hair follicles and improve hair density. In my experience, incorporating a high-quality peptide serum into your hair care routine can significantly reduce hair fall. These serums work by promoting circulation in the scalp, nourishing the hair follicles, and encouraging healthy hair growth. If you are experiencing hair shedding but haven't tried a peptide serum yet, it could be worth considering. Along with using peptide serums, ensure that your diet supports hair health. A deficiency in nutrients like biotin, zinc, and iron can also contribute to hair loss. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides essential vitamins and minerals that support hair growth. In fact, a 2018 study in Dermatology and Therapy found that supplementation with biotin significantly improved hair health in people with thinning hair. If you're unsure of your dietary intake, consulting with a nutritionist might be a good step to take. When to seek professional help. While taking the right steps at home is often enough to manage mild hair shedding, it's important to know when professional intervention is necessary. If you've been following a healthy routine, including peptide serums and maintaining a balanced diet for at least 2 months, and you're still noticing excessive hair loss, it might be time to see a dermatologist. A dermatologist can help determine the cause of your hair loss by performing various tests and assessments. These may include a scalp biopsy, blood tests to check for deficiencies or hormonal imbalances, or even a hair pull test to gauge the severity of shedding. In some cases, conditions like androgenic alopecia, male pattern baldness, or alopecia areata may require more targeted treatments, such as prescription medications like finasteride or minoxidil. In certain cases, dermatologists may recommend platelet-rich plasma, PRP therapy, a procedure that involves using your own blood's platelets to promote hair regrowth. While this treatment has shown promising results in several studies, it's not suitable for everyone, and discussing it with your healthcare provider is crucial. Conclusion: taking action and staying calm. To sum it up, losing a few hair strands every day is a completely normal part of the hair growth cycle, and it should not cause alarm. However, if you're noticing significant thinning, bald patches, or stress-induced hair loss, it's important to address the issue promptly. The first step is to try using a peptide serum to help nourish your scalp and stimulate hair growth, while also ensuring your diet is rich in hair-friendly nutrients. If after 2 months of consistent care, you still notice hair loss, don't hesitate to consult with a dermatologist to get a proper diagnosis and explore additional treatments. By understanding the natural processes of hair growth, taking proactive steps, and knowing when to seek professional help, you can maintain a healthy scalp and minimize the effects of hair loss.